Diseases of the lymphatic and immune systems. Part of the Health Information Project, www.health-info-project.com. A quick review. There are approximately 600 lymph nodes along the larger lymphatic vessels. Half of these are in the abdomen. Then there are also clusters of lymph nodes named for their location on the body. These include the cervical lymph nodes located in the neck, the axillary lymph nodes located in the underarms, and the inguinal lymph nodes located in the groin. Lymph nodes filter lymph fluid to protect the body from bacteria, viruses, and other harmful substances and malignant cancer cells. Primary lymphedema is a hereditary condition seen more often in females. It can appear in puberty with swelling of the legs. This is characterized by lymphedema that begins in the feet and works up the legs. This form is a genetic abnormality that results in an underdeveloped lymphatic system. This form is considerably more rare. Secondary lymphedema is lymphedema caused by cancer treatment, surgery, or damaged tissue, such as from burns or disease. This form is acquired rather than inherited. The treatment for any kind of lymphedema is exercise and compression. Lymphedema is not curable, but especially if caught early, can be managed. Lymphadenitis is a swelling of lymph nodes, often associated with infection. Lymphangiectasis is a swelling or dilation of smaller lymphatic vessels, usually due to blockage in nearby larger lymph vessels. Lymphadenopathy breaks down this way. Lymphedema refers to the lymph nodes. Pathy indicates disease. This term, lymphadenopathy, is a general term meaning disease of the lymph nodes. Lymphoscintigraphy is a diagnostic procedure used to detect damage or malformation of the lymphatic vessels. A radioactive dye is injected into the lymphatic system, and a scanner detects the flow of substance to reveal the structure. Splenic rupture and hemorrhage. Splenic rupture and subsequent splenoragia is most often caused by an injury to the abdominal area. The injury usually includes breakage of the spleen surface. Most splenic injury results in splenectomy, which is excision of the spleen. It is possible for a person to live without a spleen. Splenomegaly is enlargement of the spleen. It can be caused by splenoragia, infection, or an abnormal immune process. Lymphangioma. Lymphangioma is a lymphatic malformation. Many lymphangiomas are congenital, meaning they are present at birth. These are non-cancerous, fluid-filled cysts. These are often left untreated if they cause no problems, but can be treated if they are large or causing pain or discomfort. Treatment can involve laser therapy, sclerotherapy, which is injection of a chemical, or surgery. Lymphoma is a very general term that refers to any tumor of the lymphatic system, whether it be in the lymph nodes, the spleen, the bone marrow, or the tonsils. The most common types of lymphoma are Hodgkin's and non-Hodgkin's lymphoma. The majority of lymphoma patients have non-Hodgkin's lymphoma. Hodgkin's lymphoma is a disease caused by large cancerous lymphocytes called Reed-Sternberg cells, also known as Hodgkin cells. If the cancer is localized to one area, treatment may be with a combination of radiotherapy, otherwise known as radiation, and chemotherapy. The cancer is more extensive. If the cancer is more extensive, the chemotherapy may be used alone. Additionally, bone marrow transplants can be used as treatments. This cancer has a high cure rate. Non-Hodgkin's lymphoma is the most common of the two major classes of lymphoma. It encompasses all the other cancers possible in the lymphatic system, and these are numerous. According to Chobner, these cancers include two major categories: follicular, which is cancer of small lymphocytes growing in a node or follicle arrangement, and large cell lymphomas, which diffusely invade tissues. Chobner states that non-Hodgkin's lymphomas are largely B-cell cancers and rarely T-cell cancers. Chemotherapy is often used to treat non-Hodgkin's lymphomas, but since this class encompasses many cancers possible, there are quite a few treatment options depending on when it was caught and the patient's burden of disease. Radiation therapy and immunotherapy are also used. We will look at cancer more closely in a separate module. Multiple myeloma is a cancer of plasma cells. See the module on the immune system to recall plasma cells. It's a cancer of plasma cells which occurs in the soft tissue core of bones, the marrow, where the plasma cells are produced. Treatment might be with immunotherapy, oriented at unmasking cancer cells to the immune system, chemotherapy, or bone marrow transplant. Thymoma is a cancer of the thymus gland. This is a relatively rare cancer. Surgery is how it is usually treated, usually with the removal of the entire thymus gland, according to MD Anderson Cancer Center. As is the case with many cancers, a large tumor may be treated with chemotherapy first in an effort to shrink the cancerous mass prior to surgical excision. There are a number of different types of immune system deficiencies, which result in leaving the body susceptible to opportunistic infection. One type, which is inherited, is caused by a defect on the X chromosome and found almost exclusively in males. It is called severe combined immunodeficiency. In this disease, the infant does not produce enough T cells or B cells. SCID, and I'm not sure if people will say SCID or just say SCID, severe combined immunodeficiency, is often talked about as a single disorder, but it is actually a group of disorders that present similarly but are caused by several different genetic defects. Also, on a positive note, SCID has now been added to the Recommended Uniform Screening Panel, or RUSP, Recommended Uniform Screening Panel for newborns, so every baby born in the U.S. should be tested for it. SCID is not widely known by the public, but the acquired immunodeficiency syndrome, AIDS, the AIDS disease, is caused by the human immunodeficiency or HIV virus. This is much more widely known. Note the A for acquired in AIDS. The disease is transmitted sexually and by exchange of bodily fluids or sharing of needles. HIV attacks helper T cells. HIV attacks helper T cells, also known as CD4 plus or CD4 positive cells. Note that, like many viruses, it is very specific in the type of cell it uses as a host. AIDS first appeared on the world scene in the 1970s and may have been transmitted to the human population by something like a monkey bite somewhere in Africa, though the exact origin of the disease and the manner of its transmission to humans is still debated. In the US in the 1980s, it was first widely transmitted via homosexual activity, sharing of needles in illicit drug use, and via blood transfusion. Though blood banks screen for HIV now, it is readily transmitted with heterosexual activity and is much more prevalent in the wider US population today. Fortunately, the mortality rate for HIV has significantly declined, and today the disease is very manageable with a combination of antiviral drugs. Though there is no vaccine for HIV, though limited trials of some have been conducted. Unfortunately, these vaccines were only effective in a limited number of patients for limited times, and no vaccine has been licensed. This makes prevention of HIV by the use of condoms more important than ever, and it is certainly not advisable to share or reuse needles. A number of other sexually transmitted diseases, or STDs, can be prevented with the use of safe sex and sterile needles as well. A later module will cover the various agents of infection to which the immune system must respond. Allergic reactions are a common immunological response to various antigens. In the case of allergies, the immune system response is considered to be excessive. In fact, another term for allergy is hypersensitivity, and an allergen is the thing to which a patient is allergic or hypersensitive. Allergic reactions can range from mild to severe. A severe allergic reaction is called anaphylaxis. Anaphylaxis is a systemic response caused by reaction to an ingested food or drug. It is severe and can even be life-threatening. You may have heard of patients with severe allergies being prescribed EpiPens. Immunology is the branch of medicine which focuses on allergic reactions. Urticaria, more commonly known as hives, is a pale red skin rash that develops into welts. It can be caused by chemicals, environmental conditions, or stress, but is often caused by allergic reactions to certain foods or drugs. In allergic reactions, this welty rash can be accompanied by swelling of the throat, which can be life-threatening. And for this reason, anyone thinking they have allergic urticaria should see a doctor without delay. The rash can last for hours or days after initial onset, as if in severe cases, weeks. Additionally, the frequency of rashes can be important for treatment. In some cases of simple rash with no other symptoms, the rash can be treated with an oral steroid. So that's the end of this module on diseases of the immune system. And if you have any questions, diseases of the immune and lymphatic system, and if you have any questions, please feel free to contact Pat at health-info-project.com.